It's my pleasure to be invited to this discussion and to this workshop, and especially to present the caregiver perspective, because I also wear the hat of a patient and as a patient advocate, but I'm also a caregiver. So I think that's really important that we bring this back around to how do you go ahead and engage patients? How do we teach patients how to even know about clinical trials? Generally, they're not included, older patients are not included in clinical trials. The exclusionary criteria excludes them. And I would suggest that caregiver offices include shared decision-making materials that are in a plain language that patients understand, and that we can make them aware of trials well before ever being approached to accrue to a trial. And I realize that much of this information can be included in an informed consent, but I'd like to see an informed patient before they're actually approached for that trial. That's in a real world. Generally, this is not happening at this time, but we can change that. So I would also like to share the history, have them share some history about clinical trials. Why do some people have preconceived notions about what is a clinical trial? Should I join it? Is it the last thing I can take? Am I a lab rat? That type of discussion. I hear that fairly often. And also as a companion piece to include caregiver specific information, as that caregiver, after you visit the provider, the caregiver is going to be the person who's going to have to answer some questions and to try to fill in the gaps and be that second set of ears during a visit with a caregiver. And lastly, I would suggest overall that you consider including a community champion, someone who believes in, believes in clinical trials, who would be able to present information in just a community situation, much like the barbershop project, which I think is an amazing approach to not really coercing patients or expecting them to accrue to a patient, but presenting that information. And that's where you can find that community champion. If you find that person, that's the person who can really make the grassroots spread of this information. And information is necessary, and it's key for patients, and it's key for caregivers as well. So these frequently asked questions that oftentimes caregivers receive, or that are just asked in general, is what is this research and why should I participate? Oftentimes a patient will think, well, this may benefit me, but what are the costs to participate? Since they have a fair amount of knowledge because they've lived for this amount of time. And I think it's really important that we consider where they are, that we meet them where they are versus expecting them to meet us where we are. And right now that sounds like I have my patient advocate hat on, and I will go back to my caregiver hat. So the patient and the caregiver is going to wonder, is there nothing else to treat my condition? And
no caller.
Hello? That was not me. I happen to live in a retirement community and now have moved to an independent living community where the average age of patients is 87 years old. And so I'm living in this microcosm of older patients who are very informed. Some are very informed and some are not. Very much like the rocks behind me in this background. I mean, you see various, it's like the various amounts of information that people actually have, but they're all curious about clinical trials. And this is where I feel that I can work as a caregiver. I can work as a community champion to bring this information forward. And so patients are going to be asking many questions. And one thing is that they're going to ask about the cost of this. And as retired people on limited incomes, they are going to be concerned about the costs. And we can help them with those issues if we educate them earlier versus when they're asked to participate. And then if they can discuss this with their family and caregiver before deciding to participate, this is even more helpful because it takes the pressure off that patient who may not be able to come to a decision at that time. These are all very important issues that will come up for patients and for the caregivers. So I would suggest including a one-page plain language brochure for providers in their offices about clinical trials, and then also draft an informational handout for community champion or champions to discuss with their peers, to engage with them wherever they are, meet them where they are. And also that it's important that we engage the patient with the caregiver and with the provider, and that you allow time for questions. Many times the patient is only going to hear half or a portion of what is discussed. And with the caregiver, it helps to have that person there because at least they may have a question that the patient didn't think of asking, and then have a robust discussion before any decisions or even before presenting a trial. And I would underscore that with these patients, that they're often not represented in trials and do not truly represent a real world population. They probably are the largest consumers of medications, and yet this does not present, a clinical trial would not present that information that would be needed for that older population. And lastly, e-visits are very important now with COVID. And like with my husband, he doesn't use the computer whatsoever. So he was not excited to even participate in an e-visit because he didn't know what that meant. I set it up for him. I'm the caregiver, and helped him with it. He was able to have actually more FaceTime with his physician in that situation than he would have if we were in the office. And at the end of that visit, actually, that was more assistive for him to have that kind of a visit. Even though he would like to actually see the doctor in person, that isn't what is going to happen during this time. So I see some progress made, but I do believe that we need to include that caregiver, not just consider a patient, but also consider caregivers for assisting the patient, for including any type of information about the trial to that caregiver so they can truly answer questions once they exit the office. And you know, it's very difficult to as a caregiver to help someone if they have no basis, no context to base their information on other than just what they've heard. And we can do better than that. We can actually make this a much more back and forth, fluid situation, so that we would see patients understanding, caregivers understanding, and the provider also understanding where they are, and not asking more of them, but asking them to perhaps join a clinical trial.